So first, in order to do the neck stretches, you're going to place your hands behind your head. Let's have you turn slightly sideways so they can see you better, Amy. And you just, of your own volition, you bring your head down. You don't use your hands. Bring your head down, and then bring your hands forward, fold them, and allow yourself to go 1, 2, 3. And then go up with your head muscles, neck muscles, and then bring your head down again slowly, right to your chest. And then use your body to very gently give a little bit of a stretch. Each time you do it, keep going. Each time you do it, you're going to go 2 or 3 degrees beyond where you went the last time. And you just breathe, always breathe out when you do the stretch, and breathe in when you do the recovery. So you breathe out when you go down, do it with us, and let your hands pull a little bit. If there's ever any pain, stop. So you're actively moving, you're giving yourself a stretch, then you're actively coming back. You do that about 6 or 8 times. You can do it sitting at a traffic light, you can do it on a plane, on a bus, at home, watching TV, whenever. Good to do this whole series several times a day even. So now let's move on to the next one, and that's going to be at a 45-degree angle. So we're going to have you rotate the head 45 degrees to the side and place the hand of the side you rotated to on your head, and you're going to now pull your chin toward the center of the right side of your chest if you're looking to the right. And you go down and stretch 1, 2, 3, and then come up really easy, and exhale as you go down. And very easy the first time. The first time you do it, you're not going to really stretch it. You're going to take it real easy. Second time, you're going to go a little further. And each time, you're going to go a little bit further. And exhale as you go down. Actively pull a little tiny bit, never feeling any pain. Breathe in when you recover. And again, down. And recover. And then turn your head to the other side and place your other hand on the back of your head and go forward toward the center of the left side of your chest now. And actively moving. It's very tempting to use force with your other hand to help yourself, but try to always use your muscles to bring your head up and bring it down, and just stretch it a little bit more each time. And once more. That's it. Now we're going to rotate your head to the right, and then use your left hand to go over your head and pull your left ear to the left side of your chest, at the center of that part of your chest. There you go. Stretching down there and coming back. And the head does it by itself at an oblique angle, and stretch it a little bit more, and then go back up. And we'll do that a few more times, and here you're stretching partly the scalenes. You're putting tension through the intertransverse ligaments. You're putting a stretch on the joints of the neck, and make sure that you breathe while you're doing it. One more time. And turn your head the other way, and use the other hand, and go down. And make sure that you exhale as you're going down, and you're using your muscles, not your hand. Oh, and breathe out. And breathe in. And again, if any of these are painful, skip it, don't do it. One more time. And now face forward with your head, and I want you to side flex to the right. And if you side flex to the right, you're going to put your right hand over your head, just above your ear, and let your muscles take you to the side, and then give yourself a little extra stretch. And then come on back with your muscles, and then overstretch. And come on back. There's a temptation to hold it longer than 2 seconds, but good to hold it no more than 2 seconds, and you can either count 1, 1,000, 2, 1,000, or what I like to do is just count at the pace when they're down at 1, 2, 3, and then come back. And one more to the side, and 1, 2, 3. And let's switch hands and go to the other side. And go reach over and give a little bit of pressure, hardly any the first time. And the second time you do a little bit more and you go to what I call the barrier, where you can't really go anymore. It's kind of hard to go a little further than that. And then the next time after you hit that barrier, you just try to go 1, 2, 3 degrees beyond that, just a little bit, very, very slowly, and see if you can increase the range. And if you do this every day, once a day, twice a day, your range will increase. And so will your client's range if you do it with your clients. And one more. And now we'll do rotation. So you'll turn your head to the right and put your right hand over your cheek and jaw, and put your left hand in the back of your head, kind of over your ear or behind your ear, whatever's comfortable, and then take it a little further. And then bring your head back to straight with your muscles, not with your hands, and then turn again. And 1, 2, 3. And come on back. And turn, and 1, 2, 3. And come on back. Any pain whatsoever, do not do it, or go up before where the pain is. Stopping before there's any discomfort whatsoever, and working your way toward it, and creating increased mobility very, very slowly. And let's go to the other side. Change your hands. Turn to the left. And here you go. Rotate. And come on back. And rotate, using your hands to help you. And you notice that she's turning around a little bit with her body. Try not to do that. Try to not turn your body. Try to just turn your head. And come on back. And breathe out as you're stretching. 1, 2, 3. And inhale back. And again. And come on back. And one more. Come on back. Okay, well, that's 8 minutes of stretching on the neck. And I hope you enjoyed it. And do it every day. Okay, bye-bye.